Hi, this video is the art of hair transplant restoration surgery result. 1 year post-op. No, it's not real result. I mean, this is the hair transplant on advanced hair loss pattern. He's a class 5 hair loss pattern bowing from the front toward the back. And our goal is to, he's going to need at least 5,000 up to 9,000 depending on how much hair he lose more in the future and how much density he's looking at. But starting to do either 2,500 for the front half, 2,500 to 3,000 for the front half, and another 2,500 for the back half would be good. For the fact that he's up for the FUE, we can only start around 2,500, and 2,500 is a good starting point for him. So up to here is almost half of the head, and this is around up to from 2,500 to 3,000 grafts, depending how big your head is and how thick your hair too. And then a year later we can do a follow-up, and then after that he can opt for to do the back half. In the meantime, after surgery he can use medication Propecia and Rogaine for the back half as well while he wait for another surgery. Hair transplant, especially the hairline, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. If you look at his face and from the eyebrows to the hairline for Asian is around 6.5 to 7 centimeter. For Caucasian is around 7.5 to 8.5. The more narrow the face, the more arched back the hairline is. And the more round the face, the more flat the hairline is. So his face is a little bit narrow. So from the mid eyebrows, and again we use an average height as a guide, but sometimes not everybody can fall exactly within the 95% bell curve. So actually this client is 6.5. You see, from the mid eyebrow to hairline, 6.5 centimeter. From the mid eyebrow to the hairline, 6.5. And again, the more narrow the face, the more arched back the hairline. So he brought his own high school photos too, and his photo for the past couple of years. So that's kind of gave me a clue of where this hairline should be. Once we get the shape down, we zigzag through because no hairline is straight. Again, hair transplant is not just the surgical skill of the surgeon. The surgical skill will give you the density. The artistic and aesthetic detail is very, very important, and that will determine how natural your hairline is. You know, the old days you should be happy just to have hair, but nowadays having hair alone is not good enough. And you know, you can tell when a person have a hair transplant. Why? If they do the hairline all the way high up. I understand the idea of mature hairline, but it shouldn't be half of the head all the way up there. My goal nowadays is not only having a lot of hair and density hair, but you want to have the hairline that's natural for you. That as if you have no hair loss, what is the most natural and highest hairline that you should have? It's a mature hairline as well. And again, we base on average ethnic height of the hairline as a guide, but really when we build a hairline, we made a custom hairline around each individual facial structure. Make sure it's overall proportional. From the mid eyebrow to the hairline is a third. From the mid glabella to the tip of the nose is a third. From the tip of the nose to bottom chin is a third. Once we get the shape down, we'll transplant at 35-45 in the front. Changes when we go backward and changes when we go different direction. So the precise angle is important, and then the selection of hair graft is important. We transplant rows and rows single hair graft in the front, followed by the root of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. Because you don't want to transplant large, harsh roots in the front. And then how we make the site and how close we make the site determine the density. But you don't want to do too close where it doesn't grow, and yet you don't want to spread out too far in the back. That looks too sparse. And the best way to do this, instead of talking about how many follicular unit per square centimeter, because each individual blood supply and scalp are different. So the best way to do it is to get the average distance of the individual in the donor area. And so the average distance between the 2 individual hair, and that's your density. And you get the average of that. Then you feel confident that with your scalp and your unique blood supply will grow and sustain the hair at that density. And we try to mimic that unique average distance for each individual scalp. You know, the scalp for this individual is different from his brother, his mother, his father. So you cannot, you know, based on assigned number. You just base on an individual hair distance on that individual scalp, and that's how you determine density. But there's quite a bit of more too. There's a lot of steps along the way to produce good result, but that's one of them. But this patient will opt for to do the FUE, and that's why we only do 2500. FUE, as you know, is the most advanced technology available, and I do both FUE and the strip method. But the FUE I recommend for mild to moderate hair loss. For advanced like this, some people can opt for the strip method. But again, you can, with advanced hair loss, you can do the FUE as well. Just knowing the fact that we can only do the front half first, and a year later, we can only do the back half. The FUE is not, when compared to a strip method, it leaves thousands of dots of scar scattered throughout the back like a mosaic pattern, but the scar is so small and so scattered that you can't really see it, and allow you to wear your hair shorter. Versus the strip method, it will leave you a linear scar, and this linear scar is more visible and can easily detect it. Not only is less invasive, less bleeding, less chance of infection, overall less painful during recovery as compared to the strip method. But you know, no surgery is perfect. There's good and bad. And the downside of the FUE is the number of grafts we can do is less. It's 2,500. Or there are days I can go beyond 2,500. The other one is the cost. It will cost more than strip method. But then you have to weigh what is your benefit and the risk, and then go with your heart. You know, and again, with my work, the FUE and the strip, you're gonna have fantastic result. It doesn't matter which method. It's not drastic where the strip is way better than the FUE method. Even you compare my FUE hair transplant result compared to other clinic that does strip, my FUE is still better than density, because there's more to it. Yes, if you compare my strip to my FUE, the strip is maybe 5 to 10% better, but you cannot tell visibly when a person walk down the street, because the hair result gonna look dense no matter which method. So this is the art of hair transplant restoration surgery on on a client with advanced hair loss. He opted for the FUE, and we had to do 2 sessions. And a year later, we're going to do a follow-up. For more information, you can go to my website at www.mhtaclinic.com or call 1-866-999-6482 or 408-356-8600. Thank you.